In Bangalore, BGS Gleneagles Global Hospital, part of IHH Healthcare, entered into collaboration with BAPIO and BTA, the educational arm of BAPIO, with the aim of developing and providing world-class training and exchange programs for doctors and nurses in India to meet the growing demands of effective and safe delivery of emergency care across the globe. BGS Gleneagles Global Hospital hosted a conference at their Kengeri unit in collaboration with BAPIO to discuss and explore avenues beneficial of both countries from the mutual exchange of ideas and clinical staff. The memorandum of understanding will further aid in enhancing the education and training of healthcare staff through international mentorship, therefore improving the quality of care provided to patients at BGS Gleneagles Global Hospital, Bengaluru. Biju Nair, Cluster COO, Gleneagles Global Hospitals, Bengaluru, and Professor Parag Singhal, Executive Director, BTA, National Secretary, BAPIO, signed the Memorandum of Understanding in the presence of other dignitaries.
Fleming, the Officer on Special Temporary Duty in Bangalore from the Foreign Commonwealth and Development Office. I was very happy to be here today to witness the signing between the British Physicians of Indian Origin organisation, the largest, I think, of any such organisation for the physicians and other people in the medical field who give so much to our National Health Service, and our friends here from Gleneagles. I think it's really an exciting collaboration that's going to bring a number of different elements, both in terms of the mobility for doctors and nurses to have the chance to go out, upskill, have an experience of working in countries such as mine, and then being able to bring back that skill and experience and further upskill and upscale the healthcare service provision that's available here in India. But it goes beyond that. It's not just about the mobility of health professionals. It's also about research and about collaborative research between two different countries, which is already proven to be academically the kind of research, particularly in the healthcare field, which has the most impact and the most success. So I think that is also exciting. And then equally an element whereby a rural hospital here to the south of Mysore is going to benefit from some expertise, including some of the UK's expertise that advocates for primary healthcare and treatment more and more at source, rather than expecting people to travel great distances. I think that is another area of learning of great transformation. But I would emphasize the fact that it's not about one way. I absolutely believe that the learning and exchange through this partnership is going to be in both directions and further benefit the tie between the UK and India in this very important healthcare sector. So congratulations to both parties, and I look forward to see how this collaboration unfolds to the benefit and prosperity of India as well as the UK. Thank you very much.
BAPIO and Executive Director of BAPIO Training Academy, which is an educational arm to promote excellence in clinical medicine and education. And I'm really excited about this partnership. And just to re-emphasize, a lot has been talked about Indo-UK partnership. But as Mr. Fleming just said, the true partnership is when there is shared learning. And what we have created as a model is something which provides benefits to everyone. And both countries are able to learn from each other, and a model which is practical, which is implementable. And that is how we have managed to create a network of hospitals within the UK who are our partner, and also in India. And our footprint in working partnership in the hospitals is now increasing, and we are now going global also. And it gives us a fantastic opportunity to train doctors in India who wouldn't normally get training opportunity to come to UK, work there, learn some new skills, and then come back. And I think this is only going to benefit everyone. The stakeholders are trainees, the doctors, the United Kingdom as a country, and India as a country. And this is what we are excited about. And this opportunity is first in Karnataka, and it gives us a chance to expand our horizon in research, not only in training programs, but also about the nursing. So really thankful to Mr. Biju Nair for giving us this opportunity, and my colleagues, Professor Kule and Professor Batra. We all have been working hard to realize this dream. And what we will create finally through this mechanism is to realize the dream of our Prime Minister, Mr. Modi, because these doctors will serve the purpose of Ayushman.
So I'm very happy to announce this partnership between BGS Gleneagles Global Hospital and BAPIO. Both organizations are coming together to offer Indian doctors, both studying doctors and doctors who are practicing, a platform of convenience, a platform of enriching experience, both in India and abroad, not only learning but also treating patients in a very superlative way. The partnership allows us to offer to our doctors advanced platforms of knowledge and research. The platform offers us access to very highly reputed institutions in UK as mentors for taking our clinical program to the next level. It offers our sister institution, BGS Medical College, the students there who are doctors and nurses, opportunity to travel abroad, work with convenience, which is very troubling experience with multiple exams. It shortens their journey. This is a privileged partnership, and I'm extremely happy that Professor Parag has travelled all the way from UK and come to India to sign and ink this deal. I'm extremely happy to also have a very senior administrator, Dr. Bipin Batra and Dr. Kole here with me, and the privilege to have them all in one room is mine, and the hospitals, both the sister concerns of BGS, and therefore all the patients in our neighborhood are going to seriously benefit in the next 2-3 years in terms of the upliftment of healthcare services. Lastly, our commitment to Ramnagara is very strong. Our commitment to serve Ramnagara in terms of preventive medicine and in terms of ambulatory care is a direct consequence of us restarting and remodeling our Ramnagara center as an ambulatory care service. It's also a level 1 and level 2 emergency care services provider for the Bidadi industrial estate, and this partnership allows us to deliver the next level of primary care and emergency medicine care to all the residents of Ramnagara. Thank you so much.